Innovation, imagination, wonder. These are just some of the words used to describe Dr. Harvey Passes. Dr. Passes explores interesting people and ideas that will stimulate you. He questions the people who develop, create, and employ novel concepts in business and everyday lives. He especially loves to speak with successful people. How did they do it? How can you do it too? So let's join Dr. Harvey Passes in his quest of wonder and curiosity as we watch Dr. Harvey Passes Presents.
You know, I know how Lou Gehrig must have felt when he made those immortal words come to life. And he said, "I feel like the luckiest man on the face of the earth." And I must tell you, today's show reflects how I feel. Today's show is a little bit different. There won't be any guest, any live guest anyway, and there will be a celebration of sorts. You see, this is my 300th show, and I'm so thrilled that I have had the opportunity for the past 300 shows, and I don't even know how many years that is, to have produced this show. And what made this show so exciting and enjoyable for me and for many of you who have contacted me through email and through letters and phone calls, to bring you the information, mostly on Long Island, on interesting people, places, certainly a love of our wine. But the show didn't start out that way. The show started out in its first maybe 90 shows or so as a show that we entitled Tooth or Consequences. That's right, Tooth or Consequences. See, it started out as a show on dentistry. And then over time, I got a chance to meet very interesting people, exciting people. And those people were very happy to come on television. So the show evolved into something a little bit different, a little bit interesting. And we changed the title to Dr. Harvey Passes Presents because we didn't just focus on dentistry. We focused on so many different things. So we're going to look at a clip on this next 30 minutes. We're going to see some of the earlier shows and how the show has evolved and meet some interesting people. And my first clip that I'm going to bring to you, I find to be very interesting. It's a little humorous, it's a little fun, and you get a chance to meet an interesting character who tries to heckle me at the beginning, the opening of the show. And I think most of you will know who this individual is because you've seen him in many different areas. So let's roll the DVD right now and let's see him. I'm Dr. Harvey Passes, and you're watching Tooth or Consequences. But I'm stepping off, again, the beaten track, and we are now going to come to a different kind of track. Let me explain. I had an interesting phenomenon happen. I was having dinner with a friend of mine, and we were discussing a problem that I had in my house. And I had a problem where I had a leak. And we just couldn't figure out what was happening with that leak. And it was getting worse and worse and worse.
No, we were having lunch.
Well, excuse me. And as this thing was going on, I was discussing it with him over dinner. And we were trying to see how it could be fixed.
We weren't discussing as much as we were having a heated, spirited, spirited discussion.
Folks, I'd like you to meet a guest today who's on the show. His name is Steve Guttenberg. Steve, welcome to the show.
Thank you.
Star of stage and screen.
Thank you, Harvey.
And remember, what is it, 33 films?
Yes, 35, but who's counting?
Is it 35?
Yes, exactly. Harvey, can I say one thing before we
Anyway,
start?
as we were having
you look
dinner,
beautiful today.
Right.
Beautiful.
Well, now I'll shut up.
You do. You
Anyway,
look so
terrific
beautiful today.
Steve, it's great to have you down here on the show.
It's great to be here. Thank you so much.
But tell the folks at home, why are you here?
Why am I here?
I asked you.
Tooth or Consequences. You know, isn't there a town in New Mexico called Tooth or Consequences?
That's true.
Am I right?
That's the truth.
I am right. That's the whole truth.
And nothing but.
I am here, folks. Is that the camera? I'm here, folks, because my brother-in-law, Bob Jerem.
Say hi, Bob.
Here. Bob is right here. And his pal, Rich. And
Rich Finnegan.
Rich Finnegan. Are part of a great home inspection team, and I actually have a home that needed to be inspected.
That's right.
Harvey has a home that needed to be inspected.
I got problems.
And people here in the whole world might need to have their home inspected.
You have to,
and my
one way or
sister
another.
was hocking me for days, saying, "You got to do something." So I said, "You know, I'm gonna do something." I met Dr. Harvey, who, when I met you, I was so impressed by you.
Well, thank you very much.
Yes, you're very charming.
But I've always been impressed with you.
Thank you so much.
Okay, enough of this.
Very, very charming.
Love that.
And we thought that would be really cool to show your viewers
Chippendale.
all about home inspection.
Heckle and Joe.
And I must say my favorite company is Allstate Home Inspection.
Mm-hmm.
And my brother-in-law Bob and Rich, our pal, are part of that team. And I thought maybe you could introduce them to your beautiful viewers and your handsome viewers, too, at the same time.
You can't forget that. And beautiful children.
And beautiful children.
Right.
And it's the grandparents. It's the family that counts. It is. Everybody together. It's very important that we're all together. We work together. And I thought that might be fun to show this. And maybe if people need help, they could give a call or whatever. They could call you, Dr. Harvey,
Absolutely.
and say, I have a leak in the basement, and I have a problem.
I'll tell you, I got such a kick out of doing that. Steve was so crazy and zany, and in the middle of the show, his cell phone goes off. So as time went by, we did a number of shows, which were seriously close to my heart, on health issues. Obviously, being a dentist, anything in medicine intrigues me and interests me as well. And we did one show, well, actually, there were two shows, with a gentleman who is the Chief of Oncology and Hematology of Long Island Jewish Medical Center, and Dr. Canty Rai. And it was a fabulous show explaining the difference between cancers, being a liquid cancer and a solid cancer, or a liquid tumor and a solid tumor. And after I had spoken to him about it, I said, we've got to do this on television. And he was articulate and wonderful. So we get a chance to show you a little bit of that show. And that show is part of Dr. Harvey Passes Presents As We've Left, Tooth or Consequences. So let's get a chance right now to roll the DVD, and we'll get a chance to see Dr. Canty Rai. Here we go. So how do we try to save and help our loved ones at times of cancer? We did part one, and I had with me at that time, and have again, the director, the chief of oncology and hematology of Long Island Jewish Medical Center, and that is Dr. Canty Rai. This very distinguished, knowledgeable individual has very graciously given me some more of his time. And believe me, his time is very valuable. So many people come to him for help, and he travels all over the world in giving presentations on his subject of oncology hematology. And he's here today to discuss another topic in the same general area of cancer. So before I keep doing the whole show myself, let me have you meet Dr. Rai. Dr. Rai, great to have you back again.
Very nice.
Terrific. It's so wonderful of you because you travel around the world and you're extraordinarily busy. You're busier than me, and I can't believe that. And you're just amazing. Every time I call you, you call me from, New Amsterdam, or Amsterdam rather, or you'll call me from Colorado or something. You're all over the world. Unbelievable. So it's just terrific having you come here. Let me tell the folks at home where we were the last time and where we are today.
Okay.
The last time, Dr. Rai came down and we spoke about cancer. We went through a discussion of the nature of cancer, what it is, the different types of places that it hits, that it invades. That's a good word for what we're going to be talking about. And we focused on one of two general topics. One topic is called solid tumors. And those would be tumors of the stomach, of the lung, of the breast, of different parts of the body, the skin, that's solid. You can take it and you can cut it out. But then there is another type of cancer that most of us lay people would not even have an appreciation for, and that's called liquid tumors. The first one's solid, the other is liquid. And we're going to get into that today and discuss that. And you'll hear some names that you've heard before, but you're going to learn a lot more about them. So without further ado, I bring to you Dr. Rai to speak to us all about liquid tumors. Dr. Rai, what is a liquid tumor? You'll have to get a chance to see the rest of that show to understand what is a liquid tumor. But another area that intrigued me to no end is a congenital defect of the heart. When actually there's a hole in the heart when we're born that exists. And then as we get older, that hole heals up. But some of us don't have that happen to them. And you can have certain problems to exist in your life subsequently to that if you don't get it repaired. And the way to repair it has always been through open heart surgery. well, there are new techniques that have come out, and I got a hold of a gentleman who is now, I believe, the chairman of pediatric cardiology at St. Francis, and asked him to come down to help explain it. His name is Dr. Sean Levchuk. Let's check him out, and let's get a chance to see how he explains and what it was all about and what he did so that he could help kids who have this problem, because it's mostly, you're going to pick this up in kids when you see what the problem is and what's going on. So we're going to get a chance to see what he has to say and what the impact that has had on all of us. So let's roll the DVD now and let's check him out. I have some interesting things to bring to you today. As you know, my love, again, about anything that's Long Island. I've discussed things about the bounty, the food, the wine, the people. The people. I have someone in that category for you to meet today. A Long Islander and someone who is very well accomplished, a specialist, if you will, in an area of focused attention. It's an area that deals with our children. And it's an area which deals with, well, it's close to my heart, children's hearts. And it's an area where, well, there's a number of you watching this right now who have loved ones or yourself who may have this condition. And it has to do with an area in your heart where there isn't any closure and there is an opening. And we're going to discuss that today, and you're going to meet and learn from Dr. Sean Levchuk how this treatment can be accomplished today, right here on Long Island, well, in a non-invasive fashion, as opposed to opening up your chest and having it corrected, and why it should be corrected. So, without further ado, I want to bring to you Dr. Sean Levchuk. Dr. Levchuk.
Nice to meet you, Dr. Passes.
It's great to have you come down here, and from your very busy schedule, I appreciate you coming down. Let me tell the folks at home a little bit about who you are and why you're a pretty special kind of guy. Dr. Levchuk, he's director of the Pediatric Interventional Cardiac, the teeth don't fit, cardiac program at St. Francis Hospital. He's chairman of pediatrics at St. Francis. So you're doing two very interesting things here. You have a fellowship in pediatric cardiology at St. Christopher's Hospital for Children in Philadelphia. You're also board certified in both pediatrics and pediatric cardiology. You're a busy guy. You've performed over 2,000 interventional procedures in children and adults with congenital heart disease all last Thursday. No, only kidding. Okay, you've done over 800 interseptal occlusion procedures. That's procedures to close up the hole that's in certain areas of the heart. And, well, you're here today to discuss how it was done and how it can be done today. First, what is an atrial septal defect? Talk about it in plain language.
An atrial septal defect is a hole.
That is a hole in the heart. And the way he occluded it was by taking a device that looks like a little umbrella, and it's fed through one of the veins, and it goes up into the heart, opens up, and acts as a plug, and then heart muscle tissue grows over this plug, and that's it. Without having to open up the chest, the patient goes home that night, that afternoon, and it's that simple. It's that simple. Absolutely amazing. What else was amazing is that I had a conversation one day with someone, and it concerned me. It was dealing with a topic that is gaining, unfortunately, greater prominence in our lives, and that's Alzheimer's. I was very concerned about this and wanted to learn more about it. See, the beautiful opportunity in having a show like this gives me the chance to contact those people who are in the forefront of treatment of diseases, research, and to speak with them and bring them on TV so that you could learn more about this too. So I got a real kick out of this in exploring Alzheimer's. And I came across an organization called the Long Island Alzheimer's Foundation. And they have a wonderful facility right here in Port Washington helping, what can I say, victims of Alzheimer's disease, because truly it's so devastating and you do become a victim. So I became involved in speaking with some of these people, and I had on my show a neurologist and a therapist to help in this condition. And these people came on the show, and I finally understood what this condition was all about. And when you see a little clip that we've got coming up here right now, you'll get a chance to understand, as I did, what this condition is all about, how it affects us. So let's get a chance right now to see what this is all about. So let's roll the DVD and learn about Alzheimer's.
Area where memories are consolidated. So Alzheimer's disease is a very specific memory disorder initially affecting this structure, and the vast majority of memory problems occur because of the frontal lobes here, which is more of an age-related type of situation.
Okay, so neurologically, thank you. Neurologically, we now have a physical, thank you, a physical difference. You're saying Alzheimer's affects the hippocampus,
right?
Whereas regular getting old will affect the frontal lobe.
Exactly. And other type of memory problems related to stroke, affect another part of the brain. So one of the important things to distinguish when a person has a memory problems is what type of memory problem are you having, and a neurologist should be able to work it out vis-a-vis his exam, imaging studies.
To diagnose.
To diagnose and have a fairly accurate sense of, are we dealing with a degenerative disorder such as Alzheimer's disease, or is this depression, age, is this the effect of stress on one's memory ability?
Right.
And those differences are sort of topographically, neuroanatomically laid
Interesting.
out.
I didn't know that. And Barbara, before we get back to you, because we're about to, you lead me to a question, Max. I forgot what it was. No, you lead me. you lead me to a question about the. Actually, I did forget because I'm thinking about the question I'm asking you. I'm going to come back to you in one moment. That's pretty funny. I have to make an appointment to see you. What I was thinking of earlier. So then, based upon what you were talking about, as far as the frontal lobe and the hippocampus, what exactly is happening in the hippocampus? Is the tissue just dying?
Well, no one really knows clearly what the mechanisms are, but we do.
I'm keeping it a secret.
Eventually, people will determine it. There is in Alzheimer's disease an actual dying
breakdown
off
of the circuits,
of the circuits, and actually of the nerve cells. Whereas the memory problems that people experience as they get on in years, it's not so much the nerve cells that are dying, but the synapses that connect the nerve cells have become attenuated somewhat. So there's a real difference between the pathology. Once you see plaques and tangles and they're layering out in the hippocampus, then you know you're dealing with a more significant degenerative disorder like Alzheimer's disease.
Next question then. When you see the plaques and tangles, how do you see the plaques and tangles? In what kind of a diagnostic test?
So,
drill a hole in the head?
As we know that well now interestingly they're having some very sophisticated spectroscopy, MR spectroscopy. There's some PET scannings that are labeling the plaques and tangles, so we're getting a little bit of a picture vis-a-vis the more sophisticated imaging. However, still, definitive Alzheimer's disease is still a autopsy.
That's exactly where I knew you were going.
However,
what a great thing.
No one really needs to go. No one really needs to go in that direction, because the neuropsychological testing, the imaging testing, and the progression of the disease, and I think that's the key aspect, is that Alzheimer's disease will progress over a period of time, and as Barbara's pointing out, it begins to become more than just a forgetfulness type of issue. It becomes behavior and temperament, and it begins to follow, even though every individual is different and distinctive. The pattern of progression of Alzheimer's disease has a fairly well described.
Listen, like I use this as a silly equation here, a comparison here, is that people say, well, I got a root canal, I'm a dentist, and my tooth is bothering me. Shouldn't you see something on x-ray? Well, we only see the x-ray, the root canal problem, when it's later on in its disease, its progression. Right. Now, the same thing with Alzheimer's. Will you not see these plaques and tangles until it's like down the road?
They're getting very close now to being able to label these plaques and tangles, so that, interestingly, now you're beginning to pick up on the earliest phases of memory difficulty and beginning to prospectively sort of say that this person in the next 3 to 5 years is likely to develop Alzheimer's disease.
Let's take this home. Here's what I'm hearing, and you tell me if this makes good sense. So if you have an individual who is fearful and concerned that they're going down this road, They come see you, and they have a discussion. You direct to each other. First, you have to do the diagnosing. And then, so you go through diagnosing and you say, I really think we've got something going on here. It's not, not until autopsy will we know for sure, and we'll let you know then, but we think it's really heading in that direction. Then, if that's the case, it makes sense to come to your foundation, to the Long Island Alzheimer's Foundation, to be able to then start exercising the brain and to start doing weights and lifts and treadmills and everything else on the brain. And by doing that, you're then, I guess, helping the furrows here in the brain, the synapses, to keep working better and better and better.
100%. For dentists, you have a very, very profound neuroscience perspective on things. Very good.
I used to be a neurologist, and I gave it up. I found the work too boring.
Right, it's too tedious.
I think there's another very important piece that we do at the foundation.
Actually, I enjoyed the dental part of it very much, and being a neurologist just didn't cut it for me. Only kidding, I was never a neurologist. But I thought that was a very interesting segment because I got a chance to really understand and to learn what's going on. And the beauty and the joy of being able to have done these kind of shows over the past, 300 episodes has been so rewarding because I get letters from people and phone calls from people asking for direction. Where can they go to learn more about this? Or they have a loved one who wants to know about this foundation, or whatever it might be. They want to learn about a doctor who comes on the show who has discovered a new technique of doing things. I remember I had a gentleman who came on the show, a otolaryngologist, ear, nose, and throat, or actually a throat doctor, in the city, and he developed a technique for rejuvenating the voice, taking the voice. And when you've had problems, you've gotten older, or women, as they get older, their voice takes on a lower pitch. And this individual was able to rejuvenate the voice. I read about it in the Times, called him up on the phone, and he comes right down here and we do a show. So it's been just a fabulous experience to be able to learn and to see. I've had great experiences in having people from the law come on the show as well. We've had different attorneys discussing elder care, discussing criminal activities. We've even had judges on the show to explain how the court system works and to give us all a better appreciation for it. So the opportunity of being able to help you, as well as, I must tell you, learn from myself, couldn't have been better, couldn't have been more enjoyable, and it's been just terrific. We're going to move on to a different area right now. One day I found that I was just putting on too much weight, and I wasn't happy about it. And I met a chef who specializes in helping people take off weight. And lo and behold, we put me on a diet, and it worked great. It was just fantastic. But knowing the way I do things, not just being a talk show host, but being also an active healthcare provider, having the title doctor, I said, why don't we do it a little bit differently? How about if I were to give some blood to a blood study, and let's see how the blood chemistry would change through the diet. So it's not just a matter of the scale telling me I lost weight or that I can close my pants, but what happened to my cholesterol, what happened to my LDL, my HDL, my homocysteine levels, my CR, my creatinine, my C-reactive protein, everything. So we're going to show you right now an interesting clip to show you exactly what happened. Let's roll the DVD, and then we'll come back and we'll talk some more. I am absolutely excited about today's show. Today's show is a part 2. It's a part 2 in an experiment that I decided to be the guinea pig. And I decided to, share it with you and let you know what's happening. Let me remind you, if you may have missed the show, about a month and change ago, I decided to put myself on a diet. See, December rolled around and I couldn't close my pants. And I wasn't happy about that. And I met up with an illustrious chef who happened to be the executive chef for a company which tries to cook food for you so you can live a little bit longer, and it's called Zone Chefs. And he said to me, I'm going to put you on this diet and you're going to lose the weight. And I said, okay. So we discussed it some more, and I said, I got a great idea. Before I go on the diet, how about if we take some blood from me and we send it to a company called Arthrotech, which does a blood study called VAP test, which you hear about more later. and it's incredibly thorough. And we get a baseline of what I was like in my blood, my chemistry, before the diet. And then put me on a diet of really good, healthy, smart eating, which you're going to learn about today. And then after the diet's over, or, you know, when I've seen I've lost enough weight, et cetera, then let's take some more blood and see the difference. So here's what I did. Did all of that, and I lost weight, lost about 13 pounds on this diet in a little over a month. And I decided to have on the show the chef who put all this together for me, the individual whose brainchild all this was to come up with the company and get to meet all these people, and an eminent physician who decided to, he's one of the foremost authorities on lipids in the country, and we're going to discuss what that means, fat in the blood and all that other kind of stuff. And he's looking at my blood work up from before and after, and we're going to talk all about this. And get a pencil, get some paper, because you're going to start writing notes, because who knows, maybe you'll live a little bit longer after this show is finished. So let me, without further ado, bring to you the people who are on my panel today. First, Phil Andriano, Chef Phil Andriano. Phil, it's great to see you again,
Phil. It's nice to be back.
I always love talking with you. I have so much fun together.
Oh, yeah, we have a good time.
Ah, he's terrific.
I'm glad you did well on the program.
Oh, you kidding me? It was just terrific, just terrific. And first time we're meeting Arthur Gunning.
All right, pleasure.
And Arthur is the CEO and the founder of Zone Chefs.
That's correct.
Okay, and we're going to talk to you all about it.
Okay, looking forward.
Okay, now I'm going to read just a little bit here right now about Dr. Alan Baskin. Alan, thank you very much for coming to us from your busy schedule in New Jersey. And I must tell you, I lost the weight, felt good, just terrific. It was an ideal opportunity. But the other opportunities, I mean, we've had on the show here a number of reporters from the New York Times. There might be an article about something happening on Long Island, and I would contact the reporter, and he would come on, and we would discuss it in greater detail. You know, 30 minutes is a long time to talk about something. So we would pick a topic, and the reporter would feel great, because now he's not trapped in just the amount of space that the column allows, and he can get into greater detail. So we've gone through that, which was wonderful. We've had numerous authors on. I love reading. And when I get a book that really excites me, I just either get on a phone, get on the email, and I contact the author and bring the author down here. Everybody likes being on TV, especially if you've got a new book to discuss, which has absolutely been just wonderful. We've had a number of celebrities come on through the years, which has been terrific. I particularly enjoy finding celebrities who have gone through a long career where they can speak about things. I remember having Celeste Holm on. Some of you might remember who she was. And she had gained Academy Awards, Tony Awards, Golden Globe Awards. And it was great talking about her career and about the people when she was with Bing Crosby, Frank Sinatra. It just goes on and on, all the people in the films that she's made. And it's been just terrific. But it's great to bring things back, but to things that affect us. So we've had heads of hospitals on, chiefs of different departments in medicine. But one love that I've always had has been food and wine. And I've had a number of winemakers from around the world, as well as a number of chefs and chef organizations. And I love to help these people. And I function through this show as the master of ceremonies for a number of fundraising. As long as it was a not-for-profit charitable organization, I've helped them. Whether it's been the Holocaust Memorial Center of Nassau County, or whether it's been the Alzheimer Foundation here, or chef organizations, Friends of Karen. It's been just terrific. So these 300 shows have been great. I look forward to 300 more. And I want to thank you very much for being there and sharing in all this and getting a chance to take 30 minutes of your time and to watch and learn. And maybe, just maybe, I've done just a little bit to make your day a little bit brighter, enjoyable, and help you in some way or another. So, as I always say, this is Dr. Passes saying, whatever you do it with passion. Otherwise, what's the use? See you again next time. Until then, Dr. Passes saying, so long.